Welcome back. I want to talk to you about parenting during a pandemic. Now, apart from the health implications, COVID-19 brings uncertainty, it brings fear, and it brings anxiety. How can parents safeguard their children's mental health during this time? Let's get some insight and perspective. Let me bring in some of the finest minds in these fields. Dr. Mariam Seedat Khan, a clinical sociologist, as well as clinical psychologist, Professor Saths Cooper. Professor, welcome to the agenda.
Thank you for having us.
It's a great pleasure having you guys here, especially at this time. We need to map out the way forward, I guess, and help parents cope with COVID-19. Dr. Seedat Khan, if I may start with you. So a clinical sociologist, according to my knowledge, assesses situations and reduces problems through analysis and intervention. COVID-19, lockdowns, some of the challenges that COVID-19 has kicked up. I'm sure it keeps you extremely busy trying to figure out all of this. I want to talk to you about remote learning, Dr. Seedat Khan, online learning. That had to be ramped up pretty quickly here in South Africa. Some schools managed to cope, other schools had many challenges. It's been, as you would know, a challenging time for learners, parents and teachers. But were you surprised by some of the success stories from those using online platforms despite these challenges?
Well, online learning took us by surprise. It was thrust upon us, and we had to become very innovative in the way that we responded to the particular problem that arose out of the COVID-19, and particularly the shutting down of schools with little time for teachers, parents, and the department to prepare adequately to send resources home with learners. The concern originally was particularly for grade 7 and matric learners.
Yeah.
So as a clinical sociologist, my area of speciality is teaching and learning through my SMART program. And with the inability to engage in one-on-one contact, I made the decision to open up my platform free of charge to all learners from pre-K all the way to university, and for people like you and I.
Yeah.
The initial platform was restricted to students that had engaged with me on the learning intervention. However, due to the pandemic, I decided to open the platform to everyone free of charge.
Carry on.
The exciting part about it has grown to about 11,000 subscribers, something that I didn't expect at all. And the reason for that success is the teamwork. So as a clinical sociologist and an academic, I'm not a teacher, and I found lots of teachers volunteering their time, engaging with me,
right.
Not only from South Africa, but from around the world, from Dubai, from the United States.
Mm-hmm.
And people started uploading material on the Facebook group. And we ensure that everything is freely available.
Right.
There are no costs involved.
So, Professor Cooper, academics is one part of it, right? But what about learning about COVID-19? What about talking to your children about COVID-19? How do you manage children's fears at this time? How much information is too much information?
Well, look, first of all, I think that we have to emphasize that the adults in the environment need to be well themselves.
Yeah.
There's no point in having anxieties and displaying the uncertainties, which unfortunately a significant number of adults somehow manage to do in the company of their young ones. And in that way, the transmission of the anxieties, the fears, get very deeply embedded in the minds and thinking of children. That's the one part. The other is that we have a plethora of information, particularly on social media. And even in the poorest families, we tend to have little phones that people fill airtime with, and you are bombarded with information on COVID-19, such that the majority are tending to ignore that information because it's unremitting. And we've seen more recently, the SABC has covered the things that assume it's business as usual and don't adhere to minimum requirements that the experts have put out. And that is social distancing, wear a mask, wash your hands, that kind of stuff. So a lot of adults don't do that.
Yeah.
And the result is that the children learn those behaviors. But more importantly, Blaine, underlying the growth of a young human being is the ability to take in, through all senses, information, said and unsaid. And those anxieties that we tend to express or not express, kids pick up very quickly. In your earlier segment, you covered the shame, one of the key shames of our country, and that is violence against women and children.
Yeah.
We tend to prey on our women, and we tend to devastate our children. And sometimes this is regarded as animal behavior, but actually most animals don't do what we do. So in this lockdown period, what's it been now? About 3 months. The interactions between adults and between men and women would have rubbed off very deeply in a profound way on our kids, and our kids pick that up. So we've got this COVID-19 to deal with, we've got the lockdown, then we've got the frustrations that somehow men have been unable to resolve amongst themselves internally and take it out on those who they ought to protect and honor and savor for all that they are worth. Our children are our future. And if we successively subject them to the kinds of violence we do, we will continue to have this problem in the next decade. I sound like a cracked record because for decades now, I've been talking about primary prevention. We do not have, in our school curriculum, we do not have relationship building. We don't teach our children how to honor themselves and how to honor the other. And the result is that violence will perpetuate itself.
Being good role models is extremely key in this time, this uncertain time. And Dr. Seedat Khan, as the professor was saying, to a certain extent, parents have become teachers or facilitators of the learning process. For those who have opted to stay with remote learning, how can parents help in trying to keep their children engaged? I mean, what is the average attention span for a learner, by the way?
So in response to the first part of your question, I think maintaining a sense of routine is critical for the learning process. The attention span, the attention span can range anywhere between 6 minutes and 20 minutes. And the million-dollar question, Blaine, how to keep your children engaged. Ensure, depending on their age, ensure that they work for the specified amount of time as per their age group. And those times are available on the Smart Facebook group as well as the website. So if you look at what I have done is for younger children, children in preschool to up to grade 3, I have established a routine, and it starts off with a general knowledge fact in the morning, followed by mindfulness, which
Right.
Professor Cooper was talking about, the mental health. We have a physiotherapist that does exercise routines. And then we have story time that engage with the kids. We have virtual tours. But getting the child interested by using mechanisms that grab their attention.
Yeah.
I recently had an online session with a mother with 2 young children who was having great difficulty getting her children to focus. And we introduced a few methods, one of which is using whiteboard markers on a glass sliding door. It introduced a new element, a sense of excitement. We introduced a driveway, the use of chalkboard, the use of chalk on the driveway to work out math problems, shaving foam, flour. So a variety of sensory approaches that changes the perspective of the student to keep them interested.
So
now, this is a lot of work.
It is indeed. And, parents are not only grappling with coming to terms with what COVID-19 means for them, they now have to, teach their children not only about COVID-19, but, other aspects of academics of the education system. You mentioned sensory mechanisms or ways in how to improve children's focus. Routine is key. Professor Cooper, some children might have developed a routine over the last 2 months. I doubt it, but some have. Children now returning to school might be nervous to go back. It will be a transition. It's going to be a new normal. This nervousness, though, could it manifest in terms of physical illness, headaches, tummy aches, etc.? What should parents be aware of?
Well, look, the literature is replete with studies over time that at least half the issues that commonly present in doctors' rooms, in clinics, and so on, have a psychological base. And given the kinds of stresses that we've seen in our country, but under COVID at least, there's going to be new issues that present themselves, like the examples you've given, Blaine. And it's not only those physical symptoms, the fear that all is not well. And we have to draw the line here that the fault lines in our system will reveal themselves in the schooling. We've seen the controversy where it was we're opening and then we're not opening, and the sheer incompetence of the people tasked with developing our future, our children, taking care of them, with teachers' unions to, every single union objecting because they know that we've not been ready. And we've seen when some of those schools open, the spike in infection rates and so on. So kids are going to be naturally fearful on the one hand, but then they're going to be overjoyed that the lockdown, which I think has impacted them more than anybody else. The young ones are they want to spread their wings, as it were. They've been kept behind, and they don't want to lose out on engaging with their fellow students. I've listened to SAFM and other SABC stations, and where you guys have interviewed young people, and almost to a person, that each child has said, I'm missing my school, I'm missing my fellow students. So they want to get back. And it's normal socialization. But the inability of our state, again, to cater for our children is one that all of us should be concerned with. And if we're not at least, and I'll be kind and I'll say 90% ready, we shouldn't do it. Otherwise, we're going to see infection rates that we will be ruining the day on, will run like the USA, like Brazil. We do not want that. many of our kids, the fault lines are very clear. The public school system is in shambles generally, and we're going to exacerbate the wealth distribution in our country with bourgeois kids, your kids and mine benefiting versus the overwhelming majority who are going to be left behind. We cannot afford this in our country.
You're right. I mean, this cautious approach that we need to take in order to safeguard and protect our children is paramount. Dr. Seedat Khan, the schooling system is more than just about education. It should be, and I spoke to the professor about this before, it should be a safe form of childcare. It should sharpen your social skills. Friendships are developed. Do you worry that an over-reliance on online platforms might have a deleterious effect on some of those aspects of life?
Well, absolutely, and it's an important question. So there's two views around online learning. We see a portion of learners thriving with online learning. These are your learners that present with anxiety or certain challenges in the schooling system. However, the schooling system plays a very important function in our socialization. It's a very big part of who we are. We're socialized. School prepares us or socializes us for the world of work. If you look at the way the schooling system is laid out and you compare it to a work day, you see the trends are very similar. So what children are missing out on, and is of great concern to me, and Prof. Cooper touched on it, is the development of social skills. And while there are very critical developmental milestones that children reach, and this social interaction and these social skills contribute to how well they fare with these developmental milestones.
Right.
So, having said that, there is parents are finding innovative ways of virtual interactions. I had a friend recently. Her son turned 13 years old, and she had a virtual birthday party for him on Zoom or Skype with friends from school. And it was a lovely surprise for him, but also it was an important step taken by the parents to help him or make it significantly important. And socializing online, while it's different, does allow the child to socialize, but the lack of physical contact is problematic, and sure consequences for our children with regard to that.
Professor Cooper, I often wonder about fear fatigue. For example, and I'm not saying this is going to happen, but for the sake of for argument, 2,000, 3,000 people dead might not mean what it did when we were at, let's say, 100 people. People were and still are scared of dying. But do you fear, as the numbers go up, that people will stop caring about how high the numbers are and carry on like there's no virus?
Well, look, I think that we have a bigger problem of lack of caring in our society. We have almost eradicated that ability to interact with each other with consideration and compassion. Added to that, the kind of millennialism that we've seen on the rise, where it's me, I, is paramount under these COVID-19 conditions. So the fatigue is likely to happen. I think people are going to just look at these as statistics, and unless it is humanized, unless we give examples of the kinds of persons who succumb to COVID And I've seen this happen in other jurisdictions where they humanize who's passed on, particularly healthcare workers. So I think that needs to be done in our country so that it's identified with people rather than statistics, because we trot out these statistics in all sorts of ways in our society, and they just become numbing to people. You don't identify it with a person. So to do that would be the ideal, to identify that child's face who's been raped or killed, that older person who's passed on and who has family, the healthcare workers, the frontline workers who've succumbed. Because I think what's emerging is a significant number of healthcare professionals are succumbing because they're on the front line. So if we don't do that, we are going to just make this a benumbing state of providing statistics. People are not going to bother. They're just going to look more deeply at themselves. The selfishness will be on the further rise, and we need to avoid that.
I mean, it doesn't mean that if you are emotionally done with COVID, it's done with you. Dr. Seedat Khan, are you concerned with regards to this numbing state as the professor talks about?
Absolutely. A great concern for me is the mental health of students, of learners, whether they're in grade R or whether they're at university. So what we're seeing is a change in the way we live. So, in my household, for instance, I have two boys, both go to university. We're all together every day, 24 hours a day, but we're trying to get on with our lives in a confined space, adhering to the guidelines. So I think communication and, of course, there are high levels of frustration, and Prof referred to that earlier on, that present in domestic violence and child abuse and other atrocities. However, I think keeping the lines of communication open, engaging with professionals, psychologists, therapists are available for virtual online sessions, engaging with teachers if parents find they're having a problem. But, we cannot stress enough to talk to your children and look for the signs and watch out for the symptoms, changes in sleeping patterns, eating patterns, behavior, feelings of sadness or unusual behavior, not typical of your children. The biggest problem related to that is motivation for students. I'm hearing that all the time. So, our brains and our body, and we're not physically exercising, all the right chemicals required to put our brain into a toward state are not being produced by our body. So if kids are sitting in front of the TV and watching Netflix and chilling all day, or on social media, or not even reading a book, not going out to get some sunshine, then I'd be very surprised if they don't present with mental health issues.
This is the thing. I mean, Dr. Seedat Khan, maybe I'll just throw this to the professor. I mean, just drawing from my experiences with my child, he seems perfectly happy sitting at home, but many people are, experiencing some type of trauma during this lockdown, be it mild or severe. But this might sound like a bit of a left field question, but Professor Cooper, should you be concerned if you are not feeling anxious or worried about the future?
No, I think it's a normal condition. That's the normal.
Yes.
It's the only normal that the concern about the future, because we're not going to return ever again to where we were at the beginning of March. The world has changed. The economics have changed. Our livelihoods, the way we consider work and so on. And employers are going to take full advantage of this, as you've seen in the all around you and other places. There's retrenchments, there's restructuring going on, and that is going to be a serious anxiety. And while we've been talking about 4IR, it's overtaken us. In the rest of the world, people, what Mariam is doing is normal in other places. It's more or less striking in our society, but we have been left behind. We've been caught up in our own factionalized and other power struggles that we've not bothered with caring for the majority of our people. So thinking about the future is something that I think parents should be discussing with themselves and with drawing their kids in, because their kids are, our kids are smarter. Blaine, your child is much smarter than you were at that age, because your child has the benefit of instant information right now. So your child's insights can play a massive role in shaping your own thinking. And parents need to be open to that, because like the Bible says, and I'm not religious at all, but out of the mouths of babes. So we need to listen to our children. And just one other point in terms of schooling. When and if we go back to regular schooling, it's going to pose such massive strains on our infrastructure, because we simply don't have it. And importantly, our teachers are terrified. The majority of teachers are terrified of being in a school environment. That's been expressed by all the major unions. So our kids are going to in turn internalize the fear that the teachers have. And it's going to be a cyclical perpetuation of anxiety, uncertainty, and fear. But the important thing is there are breakthroughs. There's a mitigation with the steroids, obviously, but there's going to be a vaccine at some point next year. And this too shall pass, but we're not going to go back to that future that was the past. Hopefully it'll be a better future. But the way things are, I think it's going to be worse, because we're going to have more people unemployed. We're going to have more stress on the family unit. And for children, especially in crowded conditions, like we see all around the major metropolitan areas and smaller ones, it is going to be a severe issue that we need to consider. And I hope government is listening and doing something about it, because it's not going to spontaneously resolve itself.
Prof, my 9-year-old does think he's more intelligent than me. He probably is. My granny would have said he's too big for his boots. Dr. Mariam Seedat Khan and Professor Saths Cooper, we need minds like yours to help us get through to the other side of this pandemic. We thank you both for your insight and perspective. Be well.
You take care, man.
All right, we're going to take a quick break.